I tested positive for HIV in 1989. At that time, people were dying very quickly. Probably had 6 months to live. I was sick, so I thought I'd give it 3. And I remember going to one of my first intakes, and there was no place for me to check off what my ethnicity was. The person that took my intake said, there is Caucasian, and it ends in Asian. And I thought, well, I guess that's better than Oriental. I think the story that most resonated with most of the Asian and Pacific Islander audience that I've spoken to is my story with my family. My father, accepted me for being gay, which was totally, when I told him I was gay, he told me, as far as I'm concerned, everyone's gay, some people just haven't experienced that yet. And I would tell that story, and people were like, what? Your father, not your mother? Whereas my mother, she screamed, then she cried, then she threw up, and she said, well, maybe I'll get cancer. I'm like, cancer, what are you talking about? She goes, that'll be my punishment for having a gay son. In the late 80s, in New York, there's a rumor going around that Asians didn't get it. People just thought it wasn't a problem in our community. And so it was very hard to advocate for resources. It was very hard to advocate, period, because you're like, what are we talking about, And I realized that, there's just no data. So one of the first things we had to do was advocate to have more data produced. I probably didn't really get into AIDS activism until I came to San Francisco. And my partner, who was this Jewish guy from New York, came home one day, and he had AIDS. He came home, and there was an article for the Gaba Community HIV Project. And I went and I met some folks, and I really didn't understand what I was doing there. But because Jesse was my partner, they said they could take care of him. They would help me. They kind of took me under their wing and took care of Jesse. And when he died, which was in October of 1991, they kind of brought me into the field, like first as a volunteer. They gave me peer counseling training, and apparently I was good at it. And they gave me all the hard cases. And then February of 1992, I got a job at the Asian AIDS Project. Across the country, the Asian Pacific Islander communities, mostly LGBTQ organizations that were there, came together to take care of their friends. You had people in San Francisco, in LA, New York, some of the bigger metropolitan cities, and over time that became a network. They didn't always get along. They'll probably tell you, oh yes, we did. I'm like, no, you didn't. But I think we had to. If we didn't, there is a very real possibility that our communities, our members would not get the help, the care that they needed. And I think one of the things that the Asian and Pacific Islander AIDS service organizations did was they created this sense of family, this place where you could belong, this place where hopefully people understood what you were going through. And then there was Al and Jane Nakatani, who they are these parents. They lost 2 sons to AIDS and 1 to violence. Mr. and Mrs. Nakatani were like these iconic parents. They could be my mom, my dad, and they talked about their story, and they kind of also helped us come together. In New York, you had your pockets of Asians. You had Chinatown, you had the Vietnamese folks who were in different suburbs, and how to bring all those people together. Whereas what I was surprised at when I came back to San Francisco in 1991 was everybody seemed to be working together. There were political leaders, there were groups and stuff, so we were more of a mobilized community. My experience of living on the East Coast, and even Washington, D.C. has late as like 2002, that these communities were more isolated. They weren't as integrated as they seemed to be on the West Coast. December 1st, 1992, I'd only been working in the Asian and Pacific Islander community for about a year, and an opportunity came up for me to go to Guam to speak and disclose about living with HIV. And so I got there and thinking, okay, this is great. And they told me, okay, don't talk about your relationship with your mother. My mother had disowned me when I came out to her for being gay. Don't talk about your relationship with Jesse, who was my partner who just died. Don't talk about being gay. Don't talk about sex. Don't talk about the church. Don't talk about couple other things. They had this list, and they said, please tell us about your life. And I said, oh, if you take all those things out, it's really kind of hard to talk about anything. And my colleague who was with me told me that when I didn't talk about those things, I was boring. So either do that or let's go home. And so what I learned that very December 1st, 1992, was speak your truth. And the truth is, I'm human. Shame and stigma in the API culture is, it's a hard nut to crack because there's this concept about losing face, bringing dishonor to your family. That's a huge burden, I think, to bear. There's great honor in standing on the shoulders if it's positive, but like when you're doing things like coming out as trans, coming out as being gay, the fact that you may not marry and have a family, raise kids, the things that, are valued, that you're bringing shame to your family. So that's a huge responsibility, I think, for people to bear. It may be a little bit different today, but I think our community, Asian and Pacific Islanders, was very slow to get tested because if you didn't get tested, it wasn't a problem. If you didn't know, it wasn't a problem. That if we didn't talk about it, it would go away. And the denial, even if you had symptoms, you didn't realize that or you didn't want to admit to being sick until it was too late. Asian and Pacific Islander cultures don't talk about sex. They're uncomfortable around it. I know certain things like colonialism. Religious folks who came to our islands and saw these brown people and said, oh, this is dirty, and they're not clothed, put clothes on them. And I remember going to New Zealand and going to a museum, and the tikis, the penises, the private parts had been sanded off. And I said, so basically we were castrated. There were also things like transgender and the Hawaiian culture, Fafafinis, they were considered leaders in the community. But because of religion and things like that, foreigners coming in and telling us that this was wrong, stigma became attached to it. One of the challenges is that the API community is not one monolithic block. It's huge. And I remember there was a document that said there was at least 265 ethnicities and multiple languages and dialects. I'm like, God, I hope they stop counting after that, because this is going to be really impossible for us to do anything. And for like Chinese, Japanese, probably Korean, Vietnamese, and even Filipino, where there's a larger mass, it's easier to translate things. But what you want to do is you want to make sure that the terms you're using are not derogatory, are not going to give people the wrong information. A lot of times things get misunderstood just because you just can't take a brochure and like translate into an Asian language and think that the pictures are going to make sense to whoever you're targeting. They used to say like we gave out this many condoms, and so we were successful in our outreach. I'm like, but what did they do with them? Did they use them? Because so and so is using it as a decoration on their on the shelf in their apartment. I also realized that we could give people brochures until the cows or whatever you call came home. But unless they understood how that translated into action, like mentally they could get that information, but you need to be able to give them technical skills. And instead of doing the condoms on the cucumbers or these things I thought were really silly, we started telling stories in the community. And that was just totally amazing, because I think for the first time in my life, I really got to understand how these intersectionalities of my identity, my ethnic identity, my sexual identity, and all these things played out. I could see what people responded to, which was mostly me telling the truth. The greatest challenge, it depends on what we're talking about. Like if you're talking about Asia and the Pacific, our mother countries, it's access to medication. Most of them don't have access to the same kind of medications that we have here. And to me, that's an issue. It's just the fact that we are. It's like history is repeating itself. We are this huge community. And so what I worry about with so many colleagues retiring and going on to like better paying jobs or doing something else with their lives is that we're going to forget what we fought for, and that this new generation will have to fight for it again. I think in most Asian cultures, your relationship with your mother is just really important. I mean, I remember when I told you earlier, my mom disowned me. Recently, I've had to take care of them. I remembered sometime in the 90s, she asked me if I would please not die before her. God, what a horrible thing to ask of your child. But I said, Mommy, I can't guarantee that. And my mother, like back in February, she asked me if I'd had a good life. And I said, yeah, Mom, I have. I said, have you had a good life? She goes, well, you know, God gave you AIDS, but he didn't take you away from me. And so she said, because of that, I've had a good life. So I thought, wow, you know, so all the stuff from A to Z was worth it.